Have you ever felt dizzy, lightheaded, weak, or generally unwell? Do you know the difference between these conditions? Today we are going to explore these conditions in detail. Let's start with a quick overview. First up, vertigo. This condition is a sensation of feeling off balance, often described as a spinning sensation. It can be due to issues in the brain or the inner ear. Vertigo can be divided into two types, central and peripheral, each with a unique set of causes and symptoms. Next, we have lightheadedness. This is a common symptom that can make you feel like you're going to faint. It can be caused by various factors, including dehydration, sudden drop in blood pressure, or even anemia. Then, there's weakness. This is a lack of muscle strength that can make any task from lifting your coffee cup to getting out of bed feel difficult. There are many potential causes of weakness, ranging from serious diseases like multiple sclerosis to common conditions like lack of sleep or overexertion. Lastly, we have malaise. This is a general feeling of discomfort, illness, or lack of well-being. It can be a symptom of many different medical conditions, from minor ailments like the common cold to more serious conditions like cancer. It's important to understand and distinguish these conditions because they each have different causes, symptoms, and treatments. For example, vertigo might be treated with certain balance exercises or medications, while lightheadedness might be addressed by adjusting your fluid or salt intake. On the other hand, weakness and malaise often require a more comprehensive approach, considering the wide range of potential causes. By the end of this video, you'll be able to distinguish between these conditions, understand their causes, symptoms, and treatments. We'll delve deeper into each of these conditions in the following scenes to give you a well-rounded understanding of each. So, stick around and let's demystify these common yet often misunderstood conditions together. Let's dive into the first condition, vertigo. Vertigo is a sensation of feeling off balance, often described as a spinning sensation. It's as if you or your surroundings are moving when everything is actually still. This can be quite a disconcerting experience, and it's linked to a variety of causes. There are two main types of vertigo, central and peripheral. Central vertigo is related to problems in the brain, such as cerebellar stroke, vertebral basilar artery insufficiency, brain tumors, infections like meningitis, or conditions like multiple sclerosis. Peripheral vertigo, on the other hand, has to do with problems in the inner ear, which plays a significant role in maintaining balance. Conditions like vestibular neuronitis, benign positional peripheral vertigo, labyrinthitis, and Meniere disease can lead to peripheral vertigo. When it comes to symptoms, vertigo is often accompanied by nausea, vomiting, sweating, and abnormal eye movements. The duration of these symptoms can range from minutes to hours, and they may come and go. Now you might be wondering, how is vertigo treated? Well, it depends on the cause. For instance, benign positional peripheral vertigo, one of the most common types of peripheral vertigo, can be treated with a series of specific head and body movements known as the Epley maneuver. This maneuver helps to move the tiny calcium crystals in your inner ear that may be causing the vertigo. Medications can also be used to alleviate the symptoms of vertigo. Meclizine or diazepam are often prescribed to reduce dizziness and loss of balance. In some cases, a scopolamine patch may be used. In addition to these treatments, it's crucial to manage any underlying conditions that might be causing the vertigo. For example, if a stroke or a brain tumor is the culprit, these conditions would need to be addressed directly to alleviate the vertigo. It's important to note that identifying the cause of vertigo involves a detailed medical history and physical examination. In some cases, further tests may be needed, such as a CT or MRI scan. Remember, if you're experiencing vertigo, it's important to seek medical attention. While it may be a symptom of a benign condition, it could also signal something more serious. That was a brief overview of vertigo, a condition that can be quite debilitating but is often treatable with the right approach. Stay tuned as we delve into our next condition, lightheadedness. Moving on, let's talk about lightheadedness. Unlike vertigo, lightheadedness is the feeling of being about to faint or pass out. It's a sensation of unsteadiness, a temporary loss of balance that can be quite disconcerting. But what causes this sensation? An array of factors can lead to lightheadedness. Anemia, for instance, can cause this sensation. Anemia is a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your body's tissues. This lack of oxygen can leave you feeling lightheaded or weak. Another cause is decreased cardiac output, which simply means your heart isn't pumping enough blood as it should. This could be due to a variety of heart conditions, from heart failure to abnormal heart rhythms. When your heart can't pump enough blood to meet your body's needs, you may feel lightheaded or dizzy. Dehydration is yet another common cause. When your body loses more fluid than it takes in, it can lead to a drop in blood pressure and a feeling of lightheadedness. This is often seen in cases of excessive sweating, fever, or inadequate fluid intake. Other notable causes of lightheadedness include bradycardia, a slower than normal heart rate, orthostatic hypotension, a form of low blood pressure that happens when you stand up from sitting or lying down, and hyperviscosity syndrome, a condition marked by thickened blood. When it comes to symptoms, lightheadedness often comes with a feeling of faintness or near fainting, unsteadiness, or a loss of balance. It's important to note that while these symptoms can be bothersome, they are usually not a sign of a serious long-term condition. Now let's talk about treatments. The treatment for lightheadedness largely depends on its cause. For instance, if anemia is the culprit, treatment might involve dietary changes or supplements to increase your body's iron or vitamin B12 levels. If the cause is dehydration, then rehydration with fluids and electrolytes is the key. When it comes to decreased cardiac output or bradycardia, the treatment might involve medications, lifestyle changes, or in some cases surgery or a pacemaker. As you can see, the treatments are as varied as the causes, so it's crucial to pinpoint the root cause for effective treatment. In conclusion, lightheadedness is a fairly common symptom that can stem from a variety of causes, but it's usually not a sign of a serious long-term condition. If you're experiencing frequent or severe lightheadedness, it's always best to consult with a healthcare professional who can help determine the cause and appropriate treatment for your symptoms. The third condition we will discuss is weakness. This is a decrease in the strength in one or more muscles. Weakness can be a perplexing symptom, often making the simplest tasks challenging. It can occur in any part of the body and is often associated with a variety of conditions, making the root cause sometimes elusive to pinpoint. There are numerous potential causes of weakness. It might be the result of physical exertion, a lack of sleep, or an underlying health condition. Certain medications can also lead to feelings of weakness. Some serious medical conditions, such as stroke or heart disease, may also present weakness as a symptom. In some cases, weakness could be a sign of a neurological disorder, such as multiple sclerosis. The accompanying symptoms of weakness can provide clues about its cause. These might include fatigue, loss of appetite, or unexplained weight loss. Other symptoms can be more serious, such as difficulty breathing or a change in consciousness. If you experience any of these symptoms, it's essential to seek medical attention promptly. When it comes to treatment, it largely depends on the underlying cause. If weakness is due to overexertion or lack of sleep, rest and proper nutrition might be all that's needed. When it's a side effect of medication, adjusting the dosage or switching to a different drug may alleviate the symptom. For more serious conditions, treatment might involve medication, physical therapy, or even surgery. It's important to remember that while weakness can be uncomfortable and frustrating, it is often a symptom rather than a disease in itself. By addressing the underlying cause, it's possible to manage or even reverse feelings of weakness. Although weakness can be a symptom of other conditions, it can often be managed or even reversed with appropriate treatment. Always consult with a healthcare professional if you're experiencing persistent or unexplained weakness. They can help determine the root cause and guide you toward the most effective treatment options. Remember, understanding is the first step towards managing and overcoming any health challenge. Finally, we'll explore malaise. This is a general feeling of discomfort, illness, or lack of well-being. Malaise is a broad term, a sort of catch-all for when you're not feeling quite right, but can't put your finger on why. It's like the check engine light of your body, signaling that something might be off kilter. Malaise can be caused by a wide range of factors. It may be a symptom of a physical health issue, such as an infection, hormonal imbalance, or chronic conditions like heart disease or diabetes. It can also be a sign of mental health conditions like depression or anxiety. Even lifestyle factors such as poor sleep, unbalanced diet, or excessive stress can cause feelings of malaise. The symptoms associated with malaise also vary greatly. They can range from physical symptoms like fatigue, headache, or body aches, to emotional symptoms such as feelings of sadness, hopelessness, or irritability. The key is that these symptoms are persistent and impact your day-to-day life. So, how is malaise treated? Because it can be a symptom of many different things, the treatment really depends on identifying the underlying cause. If malaise is due to an infection, for instance, antibiotics may be prescribed. If it's a result of a mental health condition, therapy or medication could be beneficial. For malaise caused by lifestyle factors, changes in diet, exercise, sleep habits, or stress management techniques may be recommended. It's important to remember that malaise is often your body's way of telling you it's fighting something off. It's like a cry for help, signaling that it's time to slow down, take care of yourself, and seek help if needed. If you're feeling persistently unwell, don't ignore it. Reach out to a healthcare professional who can help identify the cause and guide you in the right direction. So malaise is a vague symptom that can be a sign of many different conditions. It's important to listen to your body and seek medical attention if your malaise continues or worsens. Now that we've gone over these conditions, let's summarize the key points. Firstly, vertigo. It's an illusion of movement where one feels as if they or their surroundings are spinning. It can be divided into two categories: central and peripheral. Central vertigo may be caused by conditions such as cerebellar stroke, vertebral artery dissection, or multiple sclerosis, among others. Peripheral vertigo, on the other hand, can be caused by conditions like vestibular neuronitis, benign positional peripheral vertigo, or Meniere disease. Tests and treatments vary depending on the root cause, but they may include the HINTS exam, Epley maneuver, or medication like meclizine or diazepam. Next, lightheadedness. This is a sensation of faintness or nearly fainting. Causes can range from anemia, decreased cardiac output, to dehydration or even orthostatic hypotension. It's important to note that lightheadedness should be treated as pre-syncope or syncope, with the differential diagnosis being the same. Tests for lightheadedness may include blood tests, glucose levels, or an EKG. Moving on to weakness. This is a lack of physical or muscle strength and the feeling that extra effort is required to move your limbs or other parts of your body. Causes can be as varied as the conditions mentioned above, or due to other factors like certain medications or B12 deficiency. The key is to identify the underlying cause to treat it effectively. Lastly, malaise. This is a generalized feeling of discomfort, illness, or lack of well-being that can be associated with many conditions. It's a symptom that can be triggered by almost any health condition. It often occurs with fatigue and an inability to function at your usual level. Distinguishing between these conditions is crucial. While they may seem similar, each has unique characteristics and causes. Vertigo involves a feeling of spinning, while lightheadedness is a sensation of nearly fainting. Weakness is a lack of physical or muscle strength, and malaise is a general feeling of discomfort or illness. Remember, each of these conditions is a symptom, not a disease itself. They may indicate underlying health issues that need to be addressed. Identifying the correct symptom can aid in diagnosing the correct condition, leading to more effective treatment. Treatment of these conditions largely depends on the underlying cause. It can range from medication to physical maneuvers, lifestyle changes, or even surgery in severe cases. Always consult with a healthcare provider for an accurate diagnosis and treatment plan. Understanding these conditions can help you better communicate with your healthcare provider and ensure you get the right treatment. Remember, it's always important to seek medical advice if you're unsure about your symptoms.